we're going to ask all our speakers to talk at the start, and then we're going to save the section at the other second half for Q&A. So we really want to have a lot of vibrant conversation in the chat. Just talk about anything that comes to mind as people are talking, but we'll do the whole Q&A. We want it to be people to unmute themselves. We've got a lovely small group joining us today, so we want more of a discussion than just throwing slides at you, but we are actually going to throw a few slides at you at the start, and then we're going to talk a bit more afterwards. It is being recorded because we do know that we kind of shared this quite late in the day, so lots of people couldn't attend. So we thought the best way to get this conversation out to more people is to record it, and then we can share this, because I don't know many people who are talking about this within the social care field. So I think it's a great conversation to share with other people. But it does mean that if you are joining us and you have got your camera on and you actually prefer it not to be on, then you might want to just take the video sharing option off, but you might absolutely be fine with that. So you don't need to if you're okay with that, just to make you be aware. And obviously it's going to be a lovely conversation we'll have at the end of this, and we're looking for really good feedback. So do keep it polite and consider other people's feelings, but I'm sure that we're going to have a very good, positive conversation anyway. So a little bit about us, if you don't know about Coproduce Care already. So I set up Coproduce Care last year, and the whole idea was to give social care a better voice. This is obviously before COVID, and we're a non-profit organisation. We don't have any funding at the moment. We're full of volunteers, people in the care organisation I work with who are helping me, and we're just doing the best that we can in terms of supporting people to respond to government consultations. That's our first thing that we try to do, and that's moved on now to having a discussion and democratizing the care debate. So what we've been doing of late is live streams, which you can catch up on YouTube, and we've interviewed everyone from people with lived experience to carers to Jez, who's Bethany's dad. So he's a parent who Bethany, who, if you know that story, has had some really terrible experiences in mental health hospitals, to the Minister for Care, Helen Whately, and a whole host of people. So it's a cross section of people we're having conversations with, really to open up the debate. So it's not snippets of 10 5-minute interviews you get on the news, but it's in-depth conversations that people can interact with. Last night we spoke to Sky, so Catherine Smith. You can catch up on that on our YouTube. So again, just a bit of information there. And I'm Sophie Chester-Glynn. I explained before, I'm also doing a PhD part-time at Bristol University. So that's a bit of context around us. And if you've got further questions, then put them in the chat and my team will try and answer those. But first of all, we thought we'd do a little bit of interaction with people, and we're going to put up a couple of polls. Have a go, have a guess, and see how you get on with answering these. So the first question is asking, how many more women are there working in social care than men, roughly? So have a go at that. You should be able to then scroll down. If you're having any problem with the poll, just let us know in the chat. I can't see the chat at the moment, but one of my colleagues will help us out. Great, votes are coming in. Second question, after 20 years experience in care, how much would you expect your pay to rise per hour on average? Have a stab at that. And then thirdly, how much more unpaid or domestic care work do women carry out than men? So this is generally, I believe. So we'll give that another couple of seconds for people to get involved with that. And what we're going to do, we're going to share the answers to these just after we've heard from our speakers and see how close you were. It's not a test, but it's just something to get people thinking about this subject. So I've seen the majority of people have voted, still waiting for a couple of more. So it might be a lag on my end. I'm getting thumbs up from my team. So we might be okay to get going on to the agenda, but I will go on to the agenda while people are still thinking. So, right. So I've done I'm going to do a few introductions. Pretty much finished on there. The last thing to go through is the agenda. So we'll be kicking off with Will Fenton from Skills for Care. So Skills for Care is an organisation which supports mainly registered managers, but really people who work in social care, collects a lot of data around social care. If you want data around social care, it's really Skills for Care you need to go to. There's not really anywhere else that does it to the extent that they do and has done it for the length of time that they have been doing it. Every year they bring out a report that looks at the profile of social care. It drills down into areas, ethnicities. I very much recommend that you go onto their website. If you just Google Skills for Care data, that should bring up their website. Very clear. You can get data through region, nationally, regionally, and then I think there's another option as well. So do give that a go. But he's going to talk to us specifically around the statistics on gender that Skills for Care has. Then we're going to move on to Rebecca Manson-Jones, and we're very lucky to have her here from the Women's Equality Party, and she'll be talking about care and aims. And then we have our apprentice, Gabriella, who will be talking with us about, she did a blog recently. Again, I recommend you check that out on our website, on our blog page, coproducecare.com. And she really, much better than I could, broke down some stark statistics around women, social care, caring, and specifically around intersectionality. So she'll be giving us a bit of detail around that. So I think we can probably take down the poll if we haven't already. Great. So I'm going to take that off from my screen. And just very, very quickly, the whole idea around what we're doing with this on this webinar is part of a series of themes that we've got at the moment. So last month we took part in the Health and Social Care Select Committee's inquiry, and we got 400 responses back from people who work in social care within 2 weeks. And we asked them what needs to change for the workforce, what can we do better, and so out of that we did a report, and that's also on our website under the tab Act for Care. And we thought we need to go from clap for carers to act for care. What are we going to do? And these are the themes that came out from our questionnaires with people. And so over the next few months, we're going to concentrate on each theme. We're going to do a blog. We're going to talk about these. We're going to do a webinar. So women's work is the first one. The next, we're also going to talk about whether we should nationalise social care or not. Questions around commissioning. We're going to talk about the colour of care. Whose care is it anyway, is talking about how we involve people who use services into the conversation around workforce. And then care over there is a topic around what are people doing in Scotland, what are the authorities doing in Wales in terms of supporting their care workers. I know across those borders they have workforce registered, so we want to have people within those areas talking about how that's working. So I know we did start slightly later just to make sure people could get on the call. So I'm not going to use up any more time, and I think we're going to move on to our first speaker. So if I hand over now to Will, let me know when you want me to change the slides.
Sure. Hi everyone. Yes, I'm Will Fenton. I'm the Analytics Manager at Skills for Care. Been working with Skills for Care since about 2008 when we first set up our workforce data collection. Skills for Care do a lot of different things. My team are focused on collecting data about the workforce, and then we distribute that throughout the sector. So to mention some of our reports, our funding comes from the Department of Health and Social Care, so they're using our data a lot, especially more in recent years. Our social care data has become more respected throughout the sector as we've got higher coverage, and it is used a lot, and it's used in decision making both by government and local decision makers as well. Whereas if you rewind 10 years, that didn't always used to be the case as much. So can we flip on to the next slide, please? So the main data source we use is the Adult Social Care Workforce Dataset. It's formerly known as the National Minimum Dataset for Social Care. So it's a voluntary collection. It's open to, so no one has to complete it, but it's open to all employees in the sector. We put there's various benefits in place for them completing the data set, and with those benefits, we've got about half the sector covered there. So we've got data on 20,000 workplaces and data on over 700,000 individual worker records. That's completed by the employers, but we're getting the data per worker, which is really powerful for analysis like this, because you can cross-tabulate things, so you can see gender and pay together, and you can see gender by age together. So it's a really, really powerful data set, and as well, given how long we've been going as well, you can anonymously track workers through time as well, so you can look at career progression and how people move through the sector or into the sector and out of the sector. So in terms of what we collect, I can't cover everything today, but I'll just give you a flavour of the type of things we collect. So we collect data from employers, where they are in the country, what services they're providing, who they're providing care to, how many staff they've got, the staff mix, recruitment retention measures, but then also about the workers. We collect lots of stuff on demographics, which is in there. For the reason it's in there is for equal opportunities monitoring. We also collect data on pay, the qualifications workers have, their terms and conditions. So I'm going to present some of that data here today. We've got a lot more than I'm able to cover in a short time here, but this will just to give everyone a flavour of what we've got. So can we flip to the next slide? Okay, so these are our top level estimates of the workforce. So what we do is we take the data we have, and then in the background my team work on making sure it represents the full sector rather than just the ones we know about. So you can see there, covering all jobs in the adult social care sector, 83% of those jobs are filled by females, which is in total, so that's 1.25 million women working in the sector, which is way higher than the male percentage there. And you can see in the table below, so it's not just care homes, it's care homes and care in people's homes as well. It's the same picture across the sector. Can we flip to the next slide, please? Yeah. So in different job roles, there are variations. So it's 83% overall of women. The lowest proportion there is senior management. So you can see there 2/3 of senior management roles are filled by women, which is the lowest proportion of any job role. Yeah, I'd just like to say that, I mean, this data is all quantitative, so you can see that's an area that warrants discussion and further investigation, but there's nothing qualitative here, so you can't see the story behind that. But it's certainly the reason this data exists there is to highlight things like that, which I think warrant further investigation. On the other end, you've got your professional roles like registered nurses, occupational therapists, where the representation of women is actually higher than average. They've got up to the 89% of occupational therapist roles are filled by women. Yeah, so quite a big difference in the job roles there. Can we go to the next slide, please? Yeah, so in terms of terms and conditions, so I focus this down on care workers, there's 800,000 care workers, so it's half of the sector. So focus down on this one job role and look at some of the terms and conditions. So you can see there that a higher proportion of women, female care workers, are on 0-hour contracts compared to male care workers. And again, you can see a much higher percentage of female workers are part-time compared to male workers within the same job role. Again, that's just quantitative. You haven't got any data behind that saying whether people are happy with the conditions they've got. Some people may choose to work part-time or full-time, but again, certainly that's why the data exists. It highlights this difference, which can kick off useful discussions or further investigation. Can we get to the next slide, please? Okay, yes. So looking at pay, overall, just looking at all job roles, you've got that. You can see that on average, men working in the sector are paid more than women working in the sector, by almost £1 there. The majority of that difference will be the difference we've already observed, whereby you could see men were more likely to be in your senior management roles or in your management roles. So that doesn't necessarily mean that pay is unfair. It might be something else in the background. It might be the opportunities for progression might be the reason for that. And sort of to highlight that difference, I've got care workers on this chart as well, and you can see within the same job, so within care workers in the sector, you've got women being paid pretty much the same as what men are paid. And so we've delved more into this in the background as well, so we can account for experience, length of time in the job role, and there's no we haven't found any evidence of a big difference in pay for the same work. But like I say, earlier highlighted, you have got, if you look at the job role differences, you have got a much higher percentage of men in the higher paid job roles, which is why you see the difference in the all job role figure there. So that's, like I say, there's a lot more can be done in the background. We've got a lot of data, and it can be cut in many different ways. Today I just wanted to give it a flavour of the statistics, and hopefully hopefully something interesting for people to get stuck into there with the discussions.
That's really great. Thank you so much for that, Will. I think there's plenty for people to have a think, and maybe you have questions for Will. Maybe he kind of sparked some thoughts that you may have about this. So just save your questions for later, but equally feel free to put them in the chat anyway, and we will scroll back and you'll have an opportunity to unmute yourselves as well. I thought it was really great to consider that statistic about men and the wage, and that actually differential, and actually that maybe it's something to do with the fact that there are more men in certain higher roles. And also I think with a lot of these things, and like you said at the beginning, Will, it might be that we just need to dig further down into this. It gives you a flavour, and now it's trying to unpick it. But do we really need to unpick it, or is this just enough for us to do something about it? So just some things for people to think about. And while you're thinking, we're going to move on to our next speaker for today, and that's Rebecca.
Hello. Oh gosh,
hello.
I haven't seen that for a while. Thank you very much. It's great to be invited here. It feels funny that I can't see you. My name is Rebecca. I am the Women's Equality Party health spokesperson. I came into the party in the year that it was founded in 2016. We are a political party with one clear vision, which is a gender equal country. There isn't one in the world anywhere yet. And we have 7 objectives to get us there. Can we go on to the next slide, please?
Sorry, it's taking a moment.
Okay. So my question, we had a quiz already, but if you were to complete this phrase, a woman's work is, which is a bit of a cliche, I know, things that occurred to me, never done, in the home, undervalued, all those kinds of things. Can we go on? This is what I think of. If we go to the next slide. Great, thank you. So the things that came to me yesterday, a woman's work is wherever she wants it to be, well, this is what it should be, whenever she wants it to be. It must be freed from gender and other pay gaps, which we've just been hearing about. And it must be seen, counted, because if it's not seen and counted, it can't be valued and paid properly. But also in my experience, all this work I've been doing with the Women's Equality Party is that a women's work is not just for women. Part of the issue we have with equal pay is because of this segregation between what hangs around what is still regarded to be women's work and what is men's work. We've just been hearing about how management is clearly a man's job. And that hangover is probably the thing that's informing that pay gap. But why is women's work downgraded, undervalued, unpaid and invisible? We've looked at it in a number of different ways in the last 5 years, and the answer that we keep coming back to, it's because women do it. And the work that women do, men typically don't do, and then they don't see it, they don't understand it in that way. So this drilling down that Will is doing is fantastic. So the Women's Equality Party set ourselves up to break that vicious cycle. Can we go on to the next slide, please? And the way we're going to do this, as I say, we have this one clear vision and we have 7 objectives. We're interested in equal pay and opportunity. We were talking about progression routes, equal parenting and caring, equal representation. So that might be through in the electoral sphere, or it might be through a sector, or it might be in your local council, on charity boards, whatever. We're looking at representation, equal education, equal health and medical research, and equal treatment by and in the media. And then finally, we call for an end to violence against women, because if we're not safe, the others kind of fall away. Our vision is to make the UK a gender equal country and to put the need for a Women's Equality Party into history. We want the generations of the future to think, wow, what a funny idea to have a Women's Equality Party. We want this mission completed, well, I want this mission completed in my working lifetime. And I'm 53 in a couple of weeks' time. I don't have any children, so this is going to be my legacy. I want a really restful, creative old age. I don't want to have to be on marches and being an activist anymore. So our 7 objectives were chosen and adopted by the membership, and they underpin everything that we do, and they totally intersect and cross over. We're mostly volunteers. I'm a volunteer. We're doing unpaid political work, very typical of women. Politics, like many other jobs, is propped up by unpaid and underpaid women with overpaid men at the top. And as I said, I was one of the founder members of WEP. I was attracted to the party partly because at the time I was an unpaid and very willing carer for my mother at the end of her life, and I was also looking after my father, and I was juggling that with a freelance career. It was a big financial penalty, and it did put a brake on my career progression for a little while, but I really would not have missed that experience. I learned a lot from it. I learned a lot about it, and it was very, very valuable time. So I argue and advocate for everyone, male or female, being able to spend that time with family members and for them to be supported in that. I'm also now the director of Spare Tire, which is a theatre company, and we specialise in making work with and for people living with dementias and their carers. So I've learned a lot, literally on the job, about what the care sector is all about and some of its incredible qualities and some of its flaws. It's very skilled, nuanced, physically and mentally tough, but also physically and mentally challenging and rewarding. It can be very special in the right circumstances. But I've also felt that moment when you're looked down on, exhausting, thinking it's never going to end. I've been borderline bullied, and I've been ignored by society as a carer. But I think society needs to stop talking about caring and the people who do care as if it's the worst job you could possibly go into. This low status business, it's not appropriate, and it's not my experience. But it is true, a lot of the work done by women in and outside the home, it's not valued socially, and its payment follows that. So we need to break down this mental gender divide in lots of occupations, and that's when I go back to the objectives intersecting. That objective starts at school and even earlier. So in terms of people's aspiration at school, what again is appropriate, what considered to be what a girl does, what a boy does, what a woman will do and what a man will do. Parental expectation plays into that a lot. It's impossible to talk about any of our objectives without bringing up the others. So as the equal health spokesperson, I need us to achieve equal pay and pensions, because one of the biggest determinants for ill health are poverty and social disadvantage. So in the care sector, which is a disproportionately higher employer of women, as we've seen, I need to see progression routes. and investment in training, because a life lived on national minimum wage, and I don't want to offend anyone here, whether they're a worker or an employer, it's really subsistence living, because the minimum is the point. It's an agreed minimum to live on, not what we should be aspiring to pay. And we have this in theatre as well. We have agreed minima, and we're supposed to do better. So the factors of low pay influence equal health will also include how women live, where they live. They will have longer commutes. They will neglect their own health because of those factors and their own personal development ambitions. Women work longer unpaid in the home, was one of the questions earlier, and in their communities. So in some parts of the UK, women's life expectancy is on the decline. And where women are living longer, they're living for a longer time in poorer health. So that's how they intersect for me. Gender-based violence and abuse occurs in all classes, races, geographical and financial circumstance, but women who have fewer financial means might find it harder to get themselves out of the situation. Also, the media tells us that it's normal for women to take on all the caring work and to earn a living at the same time. We saw that a lot of the women are part-time. We're guilt-tripped into thinking that we need to be that person, but we don't. We won't actually achieve equal pay and equal health until men do the work alongside us, not as a favour, not as babysitting, but as a full part of their adult lives. And I'm really not having a go at them, because I have seen some very, very good male carers, and I've worked alongside them when they were helping me care with my father. So I know it can be done. It may sound counterintuitive to say, as the representative of a Women's Equality Party, that we need men's help, but we genuinely do. We need a lot of men in those 120,000 vacancies that there currently are in the social care sector. And we need men to take on 50% of the family caring and domestic responsibilities as equal parents and carers. Can we go on to the next slide, please? There are loads of women, you know. 51% of us, as it turns out, are women. But you wouldn't know that if you were to look at who's calling the shots about how we live. And you wouldn't know if you look for us in the highly paid professions or even at the top of the female-dominated professions. So I love this quote. "I am not free while any woman is unfree, even when her shackles are very different from my own." So our project isn't just about getting what the guys have got. We want to actually reframe the conversation about what the world of work looks like and reframe it in terms of values of what our society is about. We want to do this because what's been attempted before in terms of equality hasn't been effective or very long lasting, and it hasn't reached all women and therefore all minorities as well. The pandemic has shown us that. Where there have been gains in any sector in inclusion and equality, they've mostly been at the edges, at the bottom, and they're not embedded. So as soon as a crisis like the pandemic comes along, it's the women and the minorities who fall away first. That's why it's so important that we're intersectional in our approach. To achieve systemic change and equality, our policies and our approach have to be this radical and inclusive. We're not interested in getting a seat at a table of power that is designed to serve the needs of white, cis, straight, middle class, university educated white men. We want to redesign the table. We want to redesign our understanding of society and of work. And we want to break down these artificial psychological barriers between men's and women's work. As I said, you can't value what you don't understand. And system builders don't understand what women have traditionally done. Sorry, I'm repeating myself. I'm going to flip on a bit. We work at the Women's Equality Party by seeking election to force our agenda in the equal representation stand. But we also, by being there, by standing in elections, and I've done it 4 times, when we're in debates, when we're on platform, people start talking about women's equality. They start naming it. They start addressing it. And the best thing, and this is something that we want them to do, is they start stealing our ideas and acting on them. And so for us, that's a win-win. We're getting exposure and we're getting the point across. We're not just about trying to win seats and power. What we're trying to do is change the world. Mm-hmm. So one of our big slogans is daring to care. We dare to care. We dare to invest in care and not see it as a cost. We invest in...
Another minute, please, Rebecca.
Sure. We invest in social care. in healthcare and education. That's our plan. And if you do that, according to the Women's Budget Group, you, for every pound you put in that's invested in a social care agenda, you get so much more back. And that's much better than things like pouring more concrete and the build idea. So I'm also coming here to, we are examining, like you, whether the care sector should be privatised, nationalised. Is it a mixed economy? One of the things that we are dead set on is trying to remove what can be seen as profiteering, so that there's that some of the private equity firms seem to be getting a lot of profit for shareholders and not enough going to the carers. That is one of our priorities. But we recently ran a caring campaign, and that is ongoing, where we want to look at a care-led recovery out of this crisis. And we're looking for a new settlement for social care that puts carers, thank you, and puts carers and those who need care at the centre. And we want to see full integration with the NHS. The ageing population and the growing disabled population need and deserve a fit-for-purpose care system. So I'm going to stop there, because really what I want to do is find out what you all know and what's important for you, because that will inform our policies. We have a conference coming up in October. We would love to see you there. The top price ticket is £25, but there are tickets for people who can apply for a sponsored space. So you can, the economic barrier should not exist for you. And if you don't join the party, £2 a month.
Great.
Thank you so much. Sorry.
Thank you. I feel like at some points of that, I needed to give you a round of applause. That was really some really hard-hitting, great things that you mentioned there. I love the idea around realising women's work, and also that it's not just for women. A lot of care workers also have caring responsibilities, pointing out that we also need to focus on violence against women. I know in the care sector, women do actually face quite a lot of physical or verbal aggression from people, and that needs to be recognised, as well as other stuff that happens outside of the workplace. And also the idea you mentioned around pay and pensions. There's a huge lack of parity in terms of between even pay and pensions people get in NHS and health compared to what they might get in social care. And obviously he's touching on intersectionality and talking about intersectionality. That's something that Gabriella Neal will be talking to us about now. So we've been really super cruel to our lovely summer intern, who's only been with us a few weeks, but she has been on fire with all of the things that she's been doing with us. The blog I mentioned earlier, and now she's going to do a bit of a presentation on some of the things that she's been looking at in this sphere. So Gabriella, can I hand over to you?
Hello, thank you so much. Thanks, Rebecca. That was amazing. I also wanted to give you a round of applause. It was very empowering and really interesting, so thank you. Hello, everyone. Thanks for coming today. I hope everyone's doing really good. My name's Gabriella. As Sophie mentioned, I'm a policy assistant intern at Coproduce Care. I've just graduated from a politics and international relations degree. I previously worked with Norwest Media Centre on some social change stuff, Bristol Drugs Project on the engagement team, and Bristol Women's Voice on the Zero Tolerance Initiative as well. I'm really passionate about humanitarian issues and spent most of my degree studying feminism, and I have happily carried out those interests about feminism into my internship. So yes, I've helped take part in part of this women's work project, and I've been specifically looking at how gender and race as well impacts care workers' access to adequate pay. So the next slide, please. So how can looking at gender help us understand pay inequalities in care? I just want to go over some of the things I've found and how it's useful to use feminism to understand this issue. The care workforce is heavily dominated by women, as Will had mentioned, and it also has a very high representation of non-white persons, staff. And it's one of the lowest paid sectors in the UK. The King's Fund stated that the average hourly pay for care workers is actually currently below the basic pay rate for most UK supermarkets. So that's quite a hard-hitting fact. Can I have the next slide, please? So one of my favourite feminist theories is intersectionality. I think it can be really useful whilst looking at this issue. It was coined by a feminist academic, Kimberly Crenshaw, and just to go over what this term means, just in case anybody doesn't know, it's a framework used to show how a woman's experience is not just defined by being a woman, but it's also made up of other parts of her identity. So this could be things like race, her ethnicity, sexuality, ability, and more. It also shows how a person can experience multiple forms of marginalization. And this is kind of described as systems of oppression. We've heard things before like racism or patriarchy, and how people experience marginalization under these things as part of their social identities. So we have next slide, please. So how is intersectionality useful for care work? Well, following the higher representation of women and persons of colour in the care workforce, I think it's a really important tool to use in policy work to consider the multiple barriers people can face when accessing things like pay. It can also help us see how gender and race intersects with racist or sexist attitudes around labour, domestic labour or caring. Public perceptions and attitudes surrounding care work is a key foundation to the current situation of pay of care workers. Care work is often painted really negatively. The skills are often misunderstood. They're severely undervalued. There's actually little recognition for the difficult and complex skills undertaken as a care worker. Largely the narrative around care work, as Rebecca was saying, it's been historically produced as women's work. This is partly down to a few things. A lot of the skills and competencies undertaken as a care worker are very related to attributes that have been assigned to women. So being good at building relationships, being compassionate, being nurturing, they're expected to be natural and easily facilitated and undertaken by women. As the type of skills for domestic work are embedded in this cultural history of being natural to women, there's also this underlying expectation that they should be done for free. There's little appreciation for them when they are paid for. This kind of works under a patriarchal or sexist system where women's work is systemically undervalued and it's then exploited with low wages. The Women's Budget Group said that the more women who enter a sector, it's evidence that the pay decreases, the average pay decreases. And secondly, throughout history, women have been expected to also carry out unpaid domestic work, whilst men have been expected to provide and be the breadwinner of a family. This is carried to present day. Women still have more dependents than men. They take on more unpaid domestic tasks. One of the facts we had earlier, UN Women said that women carry out at least 2.5 times more unpaid domestic work than men, and that varies across the world and goes higher depending on where you are. So due to the higher amount of unpaid responsibilities of women are also more likely to be in part-time work patterns and have limited access to professional growth. Can I have the next slide, please? So it's important to not only just focus on gender, but also focus on race. Non-white people also have to push past deep-seated views about the skills and competencies driven from racist stereotypes and attitudes of these workers. So women of colour in particular are also often undervalued and regularly face occupational segregation. This means they're in highly concentrated in jobs with even lower pay, part-time and unstable work patterns. So this shows that we need to use intersectionality to understand the disparities, not just between men and women, but women of colour and women. Women of colour will experience barriers due to their gender and race. Also, COVID-19, the pandemic is showing the heavy reliance on women while simultaneously exposing the structural inequalities in society. Women make up most of the care workforce and are people who are working in really high risk conditions. It's also really important to consider the unique impacts onto women due to their higher dependence and higher amounts of unpaid domestic responsibilities during the pandemic. Another aspect is that 72% of health and social care staff who have died from COVID-19 are Black. Black African women in the UK have a mortality rate 4 times higher than white women. The lack of PPE is disproportionately affecting these groups. Care workers work close proximity to the virus, and not having adequate pay to show that risk or access to PPE just emphasises it as an inequality issue, not just to do with underfunding of the sector. It's an inequality issue because there's even higher risk factors for certain groups. So to conclude, within our Health and Social Care Committee submission, most of the 400 care workers said that they felt the low pay that they receive is due to the lack of recognition for the skills or the work that they do. They said that pay reflects how their skills are recognised. Improved pay would then show value and recognition for the workforce. Delivering better pay for care workers will then advance the interests of women, not only just stabilising the care system, but also is steps towards gender and racial equality. And it's not just about women. This isn't just an issue about women. This is for all genders and all groups. If we improve pay, it advances everyone. So changing that narrative let's change that narrative around women's work. So thank you so much for listening. Thank you.
Thank you, Gabriella. That was wonderful. I've not heard you go through that before, and I enjoyed it. Maybe you can let us know in the chat what you thought of what Gabriella had to say there. I thought you delivered that fantastically. So we are going to look at the poll results. Can we bring those up? How do I read these now? How many women affected? So Arnie, you might need to help me here.
Hi, yeah, sorry, I did realise we can only see who answered what. No one knows the actual answers, but they came up during the talks. So for the first one there, we've got a split, almost half and half, trying to decide between 100,000 more women or 1 million more women in care. And the answer, as we saw from Will's slide, is 1 million more, roughly, in the data we had. After 20 years experience in care, how much we expect paid to rise per hour on average? A fair split across 3 different answers. It was the lowest, 15p, according to one survey. After 20 years working in care, 15p rise. How much more unpaid domestic care work do women carry out than men? And that is 2.5 times more, as got covered in the last presentation, with again a nice split of people going across all the answers. So very interesting to see. Thanks everybody.
Yes, thank you very much. I hope that was interesting to hear about those stats. So I'm going to open it up now, and I'm sure that many of you will have questions. I would encourage you to unmute yourself and just give us your question for any of our speakers here. I've noticed that somebody, Freebird Associates, I don't think that's your name.
It's Anna. Sorry, I'm on my works one.
That's fine. Hello, Anna. Welcome. Did you have a question, and who was it for?
It's a couple of points really. I think it was Rebecca was saying about full integration with health, and I think you touched on this last night on your chat last night. Is it integration with health that social care need, or is it parity? Because one of the things that really concerns me is that social care can almost becomes a medical model, and again not really valuing what it is that we do in social care. So I just question whether is it integration or is it parity, and I think my view is about parity more than integration.
Thank you for that. I totally agree with you. Great question. Rebecca, did you want to come back?
Yeah, I think it's a brilliant question, and I think I think that there needs to be some integration in the sense of if you, at the point where I realised that I was going to need to get help and care for my mother, I had no understanding that I suddenly had to learn a different language and speak to entirely different people about all and although everyone's very willing and there's a system, it's just, and most people in the broader population don't understand that social care isn't part of the NHS deal. All of that. So I think maybe it's about the membrane and the dovetailing, but I do totally take your point about this parity of value, because they are different skill sets. And you know, when my father was having living care, he needed a lot more social input, and it was as important as sort of intimate care. So I totally take your point. Thank you.
Yeah, so maybe we are moving towards thinking about parity. I mean, I am very much in the part in terms of rights and carers' rights, and for women as well, because it's predominantly women in social care. I would say if we can take some of the goodies from the NHS, the 6 months full pay, sick pay, and if we could have some of the care worker colleagues could have some of that, I mean, wow. So I'm very much in that what you're saying, Anna, I think, but also I also take your point, Rebecca, in terms of using care services for a loved one. If there's just better integration of the systems, then that just helps from a user perspective. So maybe slightly different points.
Sorry, can I just also add, is it also about, because I think the issue about language is so important that we professionalize it, and so the language that we use comes from, you know, this professional space which most people don't understand, and exactly as I wouldn't disagree with Rebecca at all, not understanding the difference between health and social care. One of it may be because of the language that we use, that it keeps those who use services over there, whereas actually, exactly as you stand for, you know, really we need to be using language that's accessible by everybody, therefore increasing everyone's understanding. I'll shut up.
No, it's fine. Language is a good point, and it's something that I think most people would agree with on that. Can I ask anyone else who would like to unmute themselves? Happy if you prefer to put it in the chat, but I'd
like to have a chat. Yeah, it's Sean here.
Hello, Sean.
I'll try and put this in the best way possible for everybody to understand, but the reason I came on this webinar really was just to find out more about this sort of subject. I run a speak-up service, for an independent speak-up service for the care sector, and as a result I visit a lot of care homes and stuff, and it strikes me that a lot of women, and again, I don't want to upset anybody, I'm not used to talking in your language, but I'll put it in the best way I can. It strikes me that there is a large proportion of women in care who have brought up children and then may spend 10, 15 years bringing up children, have not gained very many educational or skills that they can use elsewhere. And they find, as Gabriella was saying, their attributes suit care, so they move into jobs within the care sector. But when they are there, they then find themselves finding it very difficult to speak up about what's going on in care homes in terms of misconduct or abuse or just issues generally, because they feel trapped, that they haven't got the skills, if you like, to move on elsewhere outside of care. So they value their job very, very highly and feel if they speak up, they are vulnerable to losing their job. And I just wondered whether that rings true with any of you guys around people or ladies feeling trapped in that position and can't speak up whilst at work. What do you think?
That's an interesting one. It's not something that, from that perspective, when you were going to go down the road of qualifications and that, I wasn't sure. I didn't realize you were going to go around that route. Yeah. That's really interesting to say that. I think Rebecca wants to come back on that, and I will let you do that before I say anything. Yeah, Rebecca.
Sure. I'm quite happy to wait. I was just giving. Thank you for that observation. I would. One part of my practice is actually in safeguarding and whistleblowing in arts, and it's not exactly a parallel, but what you're saying resonates quite deeply, and we know that there is an issue with whistleblowing in the NHS. And I think you're right. The people really value their jobs in care.
Yeah.
and they're very committed to them, and actually are quite high skilled. But all goes back to the equal education piece I was talking about, and the fact that we don't know how to value and recognise the skills that these women have, because they're all informal, or they're often informal, whether or not they've been mothers. You know, that's. But it is about the fact that as a system, as a society, we aren't recognising this stuff, and so there's this problem about where it needs improvement. People are worried about how they could speak. I've heard that. So.
Okay, and as a result, I believe that there is a large proportion of information held within care providers with their staff, and not being like safeguarding information that isn't actually getting out and being heard and being made visible because of that problem of if I speak up, I might lose my job. I've got no other skills that could be readily used elsewhere. Therefore, I must value this job really highly. And I think there's some mental health issues here as well. I've spoken to a lot of care workers, female care workers, who said, you know, there was a time when my husband was, or partner or whatever, was made redundant. I was the only breadwinner in the family, and I was having pressure at home as well as at work not to speak up. So you know, I think. And so this lady was telling me she couldn't sleep at night because of what position she was in. So I think there's some mental health issues there as well that we, you know, I'd just like your views on.
That's really interesting discussion. It makes me think about Spivak, an academic who has a piece about can the subaltern speak, but that's very academic. But there is a question around, are we allowing people who work in care workers, women in care, are we allowing them to have a voice?
Yes.
And that is a huge issue. That's the whole reason why I did co-produce care in the first place, because I felt that people were talking at us, but they weren't listening. There was no one even asking us for our voice. That was the problem. And no one really, lots of think tanks and people commenting on the sector, but no one really going to people. So I do think there's a great point to look into in terms of how are we collecting those experiences from the workforce. The 1.6, or will correct me on this, million people who work in social care. Is that right, Will? Great. How are we collecting those voices? Because they're very vocal in the places that I'm in, the Facebook groups, and they've got some great suggestions in terms of policy. I wonder, Gabriella, in your reading for your blog, did you come across this issue? You might need to unmute yourself.
Hi, yes. It got me thinking about a lot of things, really, because I think there is a culture of fear. Women are scared, especially when they are in part-time, unstable jobs. They have dependents, they have really important responsibilities and people to care for, people to pay for. So when they're in these jobs and things aren't going very well and they're not getting paid enough and there's things they want to speak up about, maybe they can't. And also, one thing that I found when I was just trying to do some research into different organisations and groups around care is that there is literally none, or a very limited amount, of kind of care specific women's alliances or women's groups that have a voice for women in care. I think maybe that's because the care is made up of women mostly, so maybe that's why, maybe they're already a voice, but I think there needs to be more kind of alliances that have just a homogenous voice for women, so then they do have that confidence to speak up. So it's not just one person when you feel really small in your organization and feel like you can't say anything. So I think there needs to be more alliances and more organizations that are specific to women's unique situation and responsibilities. So
thank you for that. I wonder if there's anyone else who has a question, but while you're thinking, oh yes, Beth.
Hey, I did write it, but I can also say something, because as a disabled woman who is reliant upon care services, I'm in a bit of a difficult position because of the fact that obviously lockdown has hit. So I'm not here as a care professional. I'm kind of just was interested in the title, and also like I am in a situation that is affecting my own quality of life and my ability to move forward because of the fact that the social care system is just in disarray. So I have been waiting for a social care assessment to be filed since I was discharged from hospital in September last year, and have just been informed again that my social worker hasn't filed the paperwork. And it's all very well talking about this kind of stuff if the system itself isn't working to the point that the people who you're meant to be serving, their lives are being affected. Obviously COVID has kind of like affected everything else, but like there also needs to be, what am I trying to say?
I love the point that you're making, though, that we need to just ask not people who are working in the sector, but also the people who are being supported in the sector. And like, I often feel that not only do we not ask people who work in the sector what they think should happen, we don't ask people who we're looking after.
Because like disabled women were not even included in any of your statistics. And also I mentioned just briefly that it's all very well looking at demographics and black and whites, but also like the Asian population has been affected by COVID as well. And we're often missed from the table. Race has been binarized down to black and white, and actually a lot of the time there are Asian population that is being affected. And I'm just really tired of not being able to get further in my own career progression, because I'm having to do care management, which is completely unpaid labour. It is to do with ableism, because I should not have to be managing my care in order to receive care.
Yeah, but I 100% agree with you. And also we have had a lot of people who are personal assistants who have had, I talked about it last night, the frustration in that the government not providing support, not providing guidance. It's just a huge area that's just been left. But do stay tuned, because we are doing one of our webinars is specifically around people who use care services and why they haven't been reached out, and why they aren't involved in the conversation around workforce. So that's a whole set, one of these really looking at that question. So I would love you to get involved in that webinar if you can make it.
Yeah, because this time around I have a personal assistant, which is great, but I just can't pay her because they haven't filed the paperwork, and so it's a really awkward position. And it's just like, I want to move on, and I'm currently doing a master's in autism studies, and I want to be able to focus on my assignments, and I can't because I'm having to call up the social services and go, have you filed the paperwork?
So there's all that goes back to the whole idea that intersectionality going on as well. You've got so much going on for you right there. So there's a lot really that goes so much deeper. Really appreciate that. So is there anyone else with a question? Does anyone have any stats questions for Will? Because I noticed we've just gone over time. So if you do, the one I wanted to ask Will was, you said that there's a lot more that could be done in this area. Do you think Skills for Care will do any more deeper delve into this specific area?
Well, whether it's Skills for Care or anyone else, I mean, part of our job is, the main part of our job is to collect the data and put the stats out there, but it's also, it's available for, further academic studies. And yeah, I think quite a lot of what it does is set the scene, and then you see things like some of the stats I showed today on, say, like the senior manager percentage that are male. I think that would warrant further investigation. In my opinion, what's causing that difference? Who's applying for those jobs? Why is that come about? I think what I've done sort of gives it gives a window into the potential problem that's there. I don't think it answers why or how that's come about, which I think you'd need to understand if you wanted to fix it or change anything.
Absolutely. And I think it is good to have that data, that raw data that hasn't got any particular commentary around it, just so people can see the pure facts. So we're really, really grateful for having you on here. I feel like we've only just started the conversation and we've come to time. It's terrible. These things always work out this way, but there are going to be a lot more webinars. We're going to talk about race. So the point that you made about race and what that makes up the issues there, do stay tuned for that one as well, because we will be talking about the different ethnicities involved and how that affects people differently. So please do stay tuned for that one, and many, many more webinars probably into the spring we'll be doing them. We're trying to do one a month on the different topics. On top of that, we'll do webinars, and we're hoping to do maybe some Twitter chats as well if you are on Twitter. So do stay tuned with what we're doing. We have a Survey Monkey where we are collecting people's views. We've reopened our survey to find out how we should be supporting the care sector workforce more, and we want to collate those views and maybe take it as an open letter to government. But we've had 400. We are so grateful for that engagement. We want to have more. Like I said, 1.6 million people working in social care. We want to try and give them a voice. So please, we will put that link out on social media again and again. Do feel free to share, like, and fill it in. And obviously just get in touch with us on the blog, and email us if you want to follow up any other information, hi@Coproduce Care. But all is left really is to say thank you very much for taking part. It's a Friday afternoon in August when most people are chilling out and on holiday or trying to take time off. So I really appreciate our speakers coming on today. It's a really important subject to have discussion around. So thank you all very much, and have a lovely weekend. Take care, everyone.